Well, good evening, everyone, and welcome to tonight's information session and panel Q&A on Provider Connect Australia, priority access for general practice. I'll begin by an acknowledgement of country. I'd like to acknowledge that we work on the traditional lands of many Aboriginal clans and nations and pay respect to elders past, present and emerging. I acknowledge their continuing connection to land, water and culture, and ongoing contribution to help shape the life of the communities in which we all work and live. So I warmly welcome Aboriginal and Torres Strait Islander Australians who are present in this meeting tonight. Just some housekeeping before we get started into tonight's presentation. The Q&A session will be after the presentation, so we will hold and put everyone on mute until that is completed. You can ask questions during the Q&A session by raising your hand or unmute, or by typing a question into the chat, whereby we'll be monitoring questions throughout the evening. Another reminder, this session is being recorded and a follow-up email will be sent to all attendees and absentees containing copies of slides, some additional resources, and of course a link to the recording. I have to pass on my immense thanks to all of my colleagues across the state. This is a partnership, a co-delivery with all the other PHNs. And in fact, there were so many, I ran out of real estate on this slide. So much gratitude and thanks goes to all. If I have missed a logo here, please accept my apologies, but I think you can get the message that there was a lot of interest in a shared collaboration here. So thank you to all the other PHNs on here tonight. So a little introduction for tonight's presenters. So my name is Brenton Jones. I'm the Senior Digital Health Manager at the Western New South Wales Primary Health Network, and I will be your host this evening. But first up, we're going to have Jenny Snegavaya, Manager of Education at Australian Digital Health Agency. We also have Abe Bastoli, who's Manager of HealthyNet and Clinical Health Information Exchange Application Support, Service Delivery, eHealth New South Wales. And Brianna Miwad, Digital Health Educator, the Australian Digital Health Agency. And for tonight's panelists, we also have Tang Nguyen, Product Manager, Director of Services, Australian Digital Health Agency. Michael Ford, the Senior Project Manager in the Australian Digital Health Agency. And Abe will also join us for the panel discussion. So hopefully for tonight, just a reminder of the key messages that we're going to be exploring. Hopefully you can describe what Provider Connect Australia is and its potential benefits. Explain how Provider Connect Australia creates unique identifiers for healthcare services, service delivery locations, and practitioners as service delivery roles, and how these are linked across the healthcare system. Understand the role that business partners, or commonly referred to as subscribers, play in publishing to them, namely how New South Wales' health directory is benefiting from PCA. Register for Provider Connect Australia if you haven't done so yet, and we'll be walking through that. And update practice and practitioner details via Provider Connect Australia. So they're the key messages we hope you can get out of this evening. And without further ado, I'm going to get Jenny to share her screen to begin tonight's presentation. Over to you, Jenny.
Thank you, Brenton, for the introduction. I'm just waiting to make sure my screen has shared correctly, and I think everybody can see it. So I'll kick us off this evening. Thanks so much for finding some time to dial in to learn about PCA, or Provider Connect Australia. We, as Brenton mentioned, have been working with a number of PHNs across New South Wales, ACT, Queensland, and we've extended this invitation to tonight's webinar to practices who have priority access at the moment to be able to register for this service. So hopefully tonight's session will help you understand what PCA is all about and its benefits. We'll hear from one of the existing partners of PCA, and we'll give you an overview of what's involved in registering your practice, how to use the portal, how to set up your organization and kind of use it more effectively. And hopefully we'll have some time at the end to address any questions that come through. So I'll make a start at the moment, healthcare provider organizations, like those of you on the call tonight working in general practices, must maintain your service delivery details and update business partners with any changes. Now, this is a term that we'll use a fair bit tonight, business partner. This can be any organization out there that your practice interacts with and that you would typically update your details with. So, having to register with these business partners and keeping them updated with changes about your organization is a significant red tape burden for your practices, as I'm sure most of you will agree. Examples of these business partners include health service directories, online booking systems, funders, primary health networks, communication services like secure messaging providers, for example, diagnostic services, as well as public and private hospitals. So, all of these organizations that we refer to as your business partners need accurate information about your practice, and you're probably constantly updating those details already via all sorts of different forms or other portals, and it's likely taking up a significant amount of your time and energy to do so. So, the issues that come with that is when you're operating a really busy practice, any updates that you miss lead to incomplete or out of date information being stored with your business partners. So, you may remember to update five of them, but you forget one, and all of a sudden you're getting a referral for a practitioner who doesn't work in your practice anymore. It can lead to errors on forms. Sometimes these forms that you're updating your details on can be paper forms, and as a result, it can lead to transcription errors. And again, your business partner may then end up with wrong information about your services. You may not be willing to take up new programs because you might be worried about yet another organization registration process that you might have to go through. So, overall, it leads to systemic lack of accurate and up to date health service information out there. So, what we're introducing to you tonight is Provider Connect Australia, or PCA. PCA is a free service. It's provided by the Australian Digital Health Agency, and it allows you to maintain details about your organization in one place. It lets you push out updates about your practice, about the services that you offer to your business partners, streamlining your ongoing updates. So there was a pilot of PCA that commenced in November last year. During this 3-month pilot period, primary health networks, or PHNs, worked with the agency to register over 300 sites with PCA, and they assisted them with publishing information to whatever those organizations' business partners are. We gathered feedback from pilot participants and from the PHNs, and that helped inform a number of enhancements to the PCA portal. So that now makes registration for PCA a much smoother experience for you who may be registering now. So PCA is now being rolled out in a staged approach. So at the moment, we're in stage 1, and we're focusing on inviting practices who are known providers of vaccine services to register with PCA. So it's possible that your practice previously has been registered with something called Vaccine Clinic Finder Connect, or VCFC. This service is being decommissioned by July. Now, you may have used this service in the past to maintain your vaccine service details. Again, this may have been another portal that you would have had to maintain. So now you have the option to transition to PCA to maintain details about all of your health services, really, and maintain all of that information in one place. Your practice basically has been identified by the agency as a candidate for priority access. So, by expressing your interest in registering with PCA early, you can get support from your PHN or from the agency prior to July with registration should you need it. Although we'll go through the process with you today. So, hopefully you'll find it quite easy to go through that process. There will be a broader rollout of PCA to other organisations across Australia later this year. So if your organisation is someone that maybe is not a practice that's registered with VCFC, you will need to register for the service past July, but for most of you invited tonight, you are part of that kind of priority stage 1 group that can register now. So to summarize the overall benefits of PCA, what we are wanting to achieve is to reduce your duplication of effort. So with PCA, the idea is that there would be less forms for you to complete. When you need to maintain details, you can do it so in one portal, and this information can then go to your business partners, and you can even choose to do so automatically, and that will streamline the process that your organization follows when you need to notify your business partners of any changes to your organization. Now, having as many organizations as we can using PCA will help ensure that complete and up-to-date information is available in a number of directories, because those directories might be one of the business partners that you choose to publish information to. And it will reduce the time you spend probably following up or redirecting messages that maybe you received an error because somewhere your details may not have been kind of updated. So if you are someone who's a bit more of a visual person, this diagram here represents how PCA works. So it's a secure platform for you as a healthcare provider organization to update. So you would come in as one of these organizations, you would enter the Provider Connect Australia portal, and you can update your details in one kind of platform, and then you can choose who to share your information with. So on the right hand side, we've got a list of potential business partners that you might choose to publish your information to. So as an example, you can share information with, say, the National Health Service Directory. By having accurate information about your organization with this directory, it will make sure that other organizations or consumers they can access information in this directory as well, and it will help them refer patients to your practice, or potentially help kind of communicate with you electronically if needed, using some of those details. In addition to publishing to a directory, you can potentially share your information with other business partners. You can go straight to booking service systems, or your PHN, or for example, eHealth New South Wales, who is one of the new business partners of PCA. Now, we understand not all of your partners may be connected to PCA at the moment, but the agency is working with a range of different providers and connecting more and more of them to the system. So in the future, hopefully, there will be less additional forms for you to fill out when your information changes. The goal is for you to be able to use one portal and maintain your details with PCA, and choose who you would like to publish your information to. Now, on this note, we do have a guest speaker today, so I'll hand over to Abe Bastoli, who will discuss kind of from a business partner perspective how eHealth New South Wales integrates with PCA. And before I hand over to you, Abe, very quickly, I will just mention that there may be some organisations attending from outside of New South Wales tonight. So just keep in mind that this will still help you understand how some of your other potential business partners can benefit from being able to access your information from PCA. So over to you, Abe.
Thank you, Jenny, and thanks for chipping in. And even though you said this is primarily at New South Wales, there are other reasons for you to tell us about yourself, even if you're not in New South Wales. I'll explain in a minute. So New South Wales Health has been working with PCA as a collaborative partner for some time. And you can see, and I'm going to walk you through this diagram from left-hand top and down and across. So your GP practice with your service owner or manager will put in the service details into PCA. PCA will take you through everything you want to know about the service. We are going to add another New South Wales Health form so that for a practice or clinic that looks after particular medical conditions, we're going to record those. I don't want to go into too much detail, but that's what it's for. So the New South Wales Health Services Directory gets that information from PCA when you go in there and say, yep, I want New South Wales to know about it. The Services Directory provides internal services to New South Wales Health to the items down below it, HealthyNet, for e-referrals, for integrated care, and others. Now, every time you come in and say, I'm the GP service and practice, and I have 3 practitioners. We really want you to make sure you include your practitioner names, their provider number, and their HPIO. Your practice will have the IO, and that's part of the registration anyway. Now, the reason we want that is we want to move it across to the provider directory that we have, which then takes that information into the local health district electronic medical record. Now, from there, your discharge summaries, specialist letters, and admission and discharge notifications, which we're going to do, can be then pushed out as a secure message delivery broker into your general practice management system. Believe it or not, when we do an analysis in New South Wales across the state of why so many discharge summaries, just one of many, aren't getting to GPs, about 30% of them, HealthyNet, which does the delivery via the brokers, will get the discharge summary, but there's no GP associated with it. It's basically, great, we got the discharge summary, we can put it into HealthyNet, but we can't send it to the GP because we don't know who the GP is. So the idea we're trying to do here to help the districts, because it's a difficult job for them to keep everything up to date. By following this sequence, we'll pass it on and make sure every electronic medical record in the state is updated each time you go ahead and enter any update into your service. As soon as it comes into PCA, it goes into our services directory, we fire it all the way across to the electronic medical record. And when you've got your association with all the patients that have come in through any of the acute care services, it'll mean that any outbound documents can get to you and notifications. So in a nutshell, that's what it is. Now, I mentioned, what about people who are across the other side of the border? They're not in the state. We do have patients that are along the borders quite a bit, and they might jump between the two. If they nominate you as their GP, there's no reason why we can't send you those documents. So you don't need to be strictly only in New South Wales for this to work. We do have patients that nominate GPs that are off on the other side of the border at times, and that doesn't create a problem. So rather than take up too much time, I'm thinking this visually does display for you precisely how a number of things have happened. The way we've collaborated with PCA, what difference that makes within the eHealth and the services, the connections between the directories and the services is all automatic, electronic, and we can apply that to any clinical system across the state. And we really are working as hard as we can to support continuity of care between primary and acute care. Happy to take up any questions you have about this when we get to that end process. Thanks very much. I'll pass this on back to you, Jenny.
Thank you so much, Abe. And we're off to Bree, who will take us through the registration process with PCA.
Thanks, Jenny. Can you hear me?
Yep.
Awesome. Sorry about the delay there. Thank you so much, Abe. That was a really great overview of how eHealth is leveraging the Provider Connect Australia platform as a new way to enhance the way that you receive information from practices. So it's really great to hear. And I really hope that the practice staff that we have on the line today will be keen to get connected to PCA after hearing both Jenny explain the benefits of the system, as well as Abe from an eHealth New South Wales perspective as well. So let's talk now a little bit about how to actually register for the PCA platform and what's sort of involved in getting connected. I will walk through an overview of the registration process, and then also touch on some key features of using the system once the practice is registered as well. So a few things to note prior to attempting to register your practice is, firstly, to engage with the PCA system, you have to have an individual PRODA account. So I'm sure, as many of you are aware, PRODA is the National Digital Access Platform for healthcare staff to use a range of tools online. So your PRODA account is going to be required for you to log in, use those login details for access to PCA as part of the security of the system. You will also need to know your business's ABN number if you have one. And if you're registering over the coming weeks, as Jenny said, as a priority practice, given the support between now and the beginning of July, then you will also need to provide your Australian business number or your ABN to your local primary health network prior to starting the registration process, and they can assist you with getting started. Now, when preparing to register your organisation, you can also link the agency, the Australian Digital Health Agency, to your organisation as a contracted service provider in HPOS. What does that mean? Well, Abe did mention earlier that one of the benefits of using Provider Connect Australia is that your organisation's healthcare identifier information can actually be shared with the partners of your choice, which is important for integrating with programs and directories such as eHealth New South Wales. So sharing your organisation's healthcare identifier information will also enable additional features within the PCA platform. But in order for you to be actually able to share your healthcare identifier information through the PCA portal, you will actually need to allow the agency to access this information by setting this up in HPOS for your organisation. So it's a really quick process that usually only takes a couple of minutes to do in the HPOS platform. And if I'm sure many of you are familiar, but you can access HPOS through your PRODA accounts. And we have, if you have a look at the link on your screen here, and as mentioned earlier, that the slides will be shared with you following the session. But if you follow the link there or have a look at our website, there's some easy steps on how to do that linkage process in HPOS for your organisation to set the organisation up as a CSP. And that's going to allow the agency to access your healthcare identifier information. And then that will enable you to get all the functionality of the platform, including being able to integrate with those healthcare directories such as eHealth New South Wales. So that is part of the process prior to registering for the platform itself. That's part of the sort of setup or pre-registration requirements. And then finally, don't forget that you'll need to have your HPIO number, so your healthcare provider identifier for your organization, handy as well. Again, many of you will have been invited here tonight by your local PHN staff who will be able to help you get registered because you're given that priority access to the system between now and 1st of July. So please don't hesitate. If you have any issues with the pre-steps for getting registered or during the registration process, the PHNs and the agency are here to support you through the process as well. So if some of this isn't making sense tonight, or it's all very new and you do want to revisit or chat about your organization's registration, don't hesitate to reach out. There is a great deal of support available at this point in time. So here's a bit of an overview of the key steps here, or the key functions of using the system. First and foremost, you will register the organization, and I'll break down in a moment what is involved in that registration process. Then step 2 is importing your healthcare identifier information, which again, you'll only be able to do that step if you've linked the agency as a contracted service provider in HPOS prior to the registration process. Again, super simple process, and we've got some easy steps to follow to help you do that, so that step 2 can happen successfully. Then you can begin using the system, and you can do that by adding information about your healthcare locations, your services, and your providers. Then once you publish those details to your business partners of your choice, all you need to do is, for any updates of the details, come into PCA and edit those details about your services, locations, your practitioners, and you can publish those updates on an ongoing basis in the one place, so that's then pushed out, as Jenny said, to the business partners of your choice. So that's really an overview of the sort of key functionality. And let's have a little look now at the setting up or the registration process. So as you can see here, there is a setup helper wizard. So that's basically some prompts after you've logged in through your Proda account and you've accessed the portal for the first time. The portal will prompt you to register your healthcare organization with PCA in 3 steps here. So as you can see, there are sort of 3 checkpoints to completing the registration. An organization is only required to register once in PCA. Now, the platform will first prompt you to add information about your organization. So you can see there, add organization. Then the system will generate a participation agreement that can be electronically signed by an authorized person within your organization. I'll touch on in a moment what authorized person means. Then after the documents are uploaded, there are a couple of final details required before your application to register for PCA can be submitted to the agency for approval. So 3 sort of simple steps there. And as you can see, it'll kind of guide you through and prompt you to where you're up to in the next step, so that you can easily select which part of the process you're ready to do next. So yeah, just sort of to demonstrate there that the usability of the platform there and how it will guide you through that registration process. Now, we talked about sort of the second part. After you've added your organization details, you need to sign a participation agreement for using the platform. And the person who signs the participation agreement, of course, needs to be an authorized person within that organization. And they can electronically sign that participation agreement on behalf of the organization. However, what we do need is some supporting document or evidence to basically state or show that the person signing the participation agreement is authorized to do that on behalf of the organization. This evidence of authority in many cases can actually be as simple as a statutory declaration. So for, say, a practice manager, if you are signing the participation agreement on behalf of the organization, you'll simply have a statutory declaration signed and uploaded to accompany your participation agreement that you've signed to state that you are authorised to be signing on behalf of that organisation. So it could be as simple as a stat deck. However, there are other options. So if the person signing it is, say, a company director or an owner, they may choose to upload other evidence of their relationship to the organisation, and they can do that by uploading something like a document downloaded from the ASIC website. Now, a couple of quick tips here. If you do go down the route of uploading your ASIC documentation to prove that relationship between the signer and the organisation, there's a few sort of minimum requirements that need to be visible on that ASIC document. So the legal name of the business. We also need the name of the person that's signing and their role of the organisation. So that could say director or company secretary. It also needs to have the full ABN as well. The 4 pieces of information are listed here, but again, this is only required if you choose to go down the route of downloading a ASIC document from the ASIC website, or using that as your method of accompanying or authorized evidence in addition to the participation obligations, in addition to the participation agreement. However, if you do prefer to use the stat deck, then you won't need to download evidence of authority like the ASIC document. So if we look at what that could look like in the system, you can see here that the system will prompt you to upload your document. So if I just zoom in there a little bit for you, you can see there are documents for signing. The system will generate the participation agreement, so you can download to sign or you can electronically sign. And then the system is giving you the option of, so if this person, when they've logged in, for example, they're a practice manager and they've said, well, I'm going to sign a stat deck as my evidence of authority. So the system has generated a stat deck that you can download and sign. Now, we highly recommend to download and sign the stat deck that is generated by the platform. So in this window here, because it's got all of the right information and it's the right kind of stat deck. There are certain stat decks that might be approved or might not be approved, but the one that is generated by the system here is going to be the right stat deck that can be approved. And then you can see at the bottom there where the upload of those documents are available, and you can see the status. So when you do sign the participation agreement and upload it, it will be then changed from incomplete to complete. And the same thing with your stat deck. You can scan and upload your ink signed stat deck there. So once your documents are uploaded, you'll see that the system will prompt you to the final registration step there. A tip with the stat decks here is we've got an example, and again, this is on the PCA registration website. So if you need to have a look at this and just make sure that the stat deck document that you're uploading has been uploaded appropriately, you can see here there is an example of a correct stat deck, but essentially the key message with the stat decks is to make sure that any field that is not marked as optional is completed. And yeah, always use the stat deck that the system generates for you, because that will sort of pre-populate some of the fields there for you as well. So those are some tips around supporting you in getting your application submitted maybe a little bit faster and approved faster. So again, we have kind of provided some examples, some screenshots, and a detailed step-by-step on the website, and there will be links sent to you in a follow-up email after the session if you'd like some support or you'd like to have a look at that online. And again, if you are unsure about anything, don't hesitate to reach out to either your primary health network staff or us here at the agency as well. So once you're registered, the exciting part is actually using the PCA portal. Once you've submitted your application to register, you will be notified when it's been approved. So once you get the notification that your organization has been successfully registered for PCA, you can then start using the portal. Some of you may already be in this part of the process, so you may already be registered as an organization in PCA, and you may be joining today for this next bit. And this is really sort of the key functionality of the system. So once you're registered, you can log into the system, and there are a few key tasks here to complete. So the first one is adding healthcare locations. PCA allows you to share information to your business partners about your healthcare locations. Now, locations are defined as the places where your organization provides its healthcare services, and there are 3 different location types broadly. So you can see there's a physical address. So you can put in physical address information about the actual physical place where your services are being provided. You can also choose mobile units if there is a mobile unit that delivers healthcare in a range of settings, for example, at patients' residences, work sites, or at schools. And then you can also choose a virtual location option as well, for if you're doing telehealth or phone or online services. You can differentiate the difference between postal address and your physical addresses to push that kind of information to your business partners as well. Again, I know this is something that often causes a burden if you move locations, or if you're often getting or not getting the right information because it's going to the wrong address. This is the way that can help support you with that. So when you first log into the portal after registering, you'll see that your helper wizard comes up again. So your little prompt window. And here you can see the first thing it's prompting you to do is add those locations. So it's as simple as logging in and then selecting the add locations button there, because that's now enabled for you to start doing that. And then once you have added your healthcare location, it will look something like this. So you can go in and start typing in information based on whether it's a physical, mobile, or virtual location. You can also add in information about whether those locations are active or are going to be active in the future. You can also come in and edit these details by deactivating locations and so on. The PCA will also store information about the services that are provided for each of your locations. So healthcare services are basically defined as the specific services provided at particular locations. So these could be general practices, podiatry, pediatric services. I'm sure there's many. Vaccine services is another good example here. If you are providing vaccine services to patients, this is a really great way to push that information to your business partners. And you can also add additional information around those services, such as languages. You can add healthcare service provision conditions, if there are any conditions to the services that are provided, eligibilities, referral details, appointment information, and operating hours as well. So again, to give you a visual of what that might look like, here you can see an example of where a practice has added general practice as a service and accompanying information. So they've got billing information, opening days and hours, contact details, specialty areas, etc. And here you can see where you can select the business partners that you would like to publish this information to. So here we can see that the practice has selected a few business partners, and you can see that eHealth New South Wales is one of them there. So you can sort of search for and add business partners as you sort of begin and continue to use the system. Now, finally, you can also add details about your providers or the healthcare practitioners. So these are details that are imported from AHPRA and are linked to one or more of your healthcare services. And once linked, these additional details can be added about your providers. So you can add things like their role in providing healthcare services. So general practitioner, podiatrist, pediatrician, nurse, etc. You can also add details about those specific providers, such as the languages they speak and their identifier numbers, so their provider numbers or HPAIs, etc. So again, you can see here where we can add those or we can use those prompts in action. So the platform is identifying where you're up to, so they can the platform can recognize that you've added one or more locations and one or more healthcare services, and you're ready to add practitioners to those services. So you can simply click on the part that you're up to, and it will navigate straight there in the platform and allow you to add and publish your details. So to give you an example of some dummy data around the providers, you can see here where the providers have been added and additional information about those providers that are attached to one or more services that are also attached to one or more locations. So a great deal of information can be captured in the platform, and this allows you to push those updates through to the business partners of your choosing. One final feature, and probably one of the most important features that I'll touch on quickly before we hand over to Q&A, is this ongoing update feature. So if you would like to ensure that your updates are automatically sent to your business partners, you can enable that. So instead of having to update details and then publish to each of your individual partners, the whole benefit of a platform like PCA is that you can select this tick box, for example. So here you can see we've gone and we've added a new practitioner, and we're automatically publishing all future changes to a specific business partner or to all of your business partners. And this allows you to ensure that all of your business partners that you are connected with in PCA will receive the changes, additions, and updates that you provide in the platform, allowing you to provide it once and being confident that that is being pushed through to the subscribers that are receiving your information. So hope that has demonstrated that this will that this platform can support to save you a lot of time and administrative burden, and resolve some of those issues that Jenny pointed out earlier on. Now, what I'll do is just conclude with a reminder of the available resources. You can contact your local primary health network. You can access all of this information and a lot more on our website, digitalhealth.gov.au. And you can certainly call our helpline there, which is the 1300 number on your screen. Also, please keep an eye out for a follow-up email that you will receive after the session in the coming week or two, which will contain all of the information that you will need to action if you'd like to get registered or ask any further questions or receive any support about accessing PCA for your organisation. I might now hand back to Brenton from the PHN to see if we've got any questions that have come through. Thanks, Brenton.
Yeah, thanks, Bree, and thank you, Abe and Jenny. I have to say that was a very thorough presentation, to the point where we only have 2 questions so far in the chat. It was so thorough, but I have prepared some offline here. But of course, we do open up now for anyone who wants to raise their hand and unmute their mic to ask a few questions. Before I get to those who have raised their hands, I'm just going to address the 2 questions that are in the chat so far. But I now welcome, of course, Michael and Tang from the ADHA and Abe to unmute their mics and hopefully help us out with some of these questions. So the first one here from Sajida: can nurse practitioner and allied health, can they use this system? I'm pretty confident I know the answer to this question, but Tang, Michael, did you want to do the honours for this one?
Michael here. Yes, the answer is yes. However, at the moment, the PCA is being open for transition from the vaccine clinic Finder Connect to the PCA. So if you're a vaccine provider, yes, now is a good time to register, but post 30th of June, so from the 1st of July, nurse practitioners and allied health providers can use the system.
Thanks, Michael. Love the enthusiasm, but yes, there will be an opportunity come 1st of July. Another question here from Tracy. Just to clarify, the ASIC business statement isn't required in all situations anymore, i.e. if PM signs a stat deck.
Yeah, so it's 10 here. I can take that one on. So you're correct there, Tracy. So in certain situations, you may wish to instead provide a statutory declaration to say that you have the authority to enter into an agreement on behalf of your practice or your organization in lieu of supplying an ASIC statement.
Thanks, Tang. Another one from Tracy here, following up that question. How is the rollout to business partners going to proceed? Can practices encourage their current local partners? I assume that's encouraged their local partners to become a business partner.
Yeah, so the agency is currently engaging with various different sectors. And of course, we've done some research onto the business partners that you need to send your details to ensure that they are adopting PCA, that they know what this new initiative is. Of course, you can definitely encourage your partners to sign up as well to make sure that they're having those discussions with us if they are not already. But yes, we are actively engaging with various business partners to support their onboarding to PCA as we speak.
Great. To speed reading ahead here, we've got some very sophisticated questions, so I hope the panelists are ready here. One here from Jenny, are all practitioners aware and do they have to provide consent for their details to be published?
Yes, so for the second one, practitioners do have to provide the consent for the details to be published. So if a practice manager is acting on behalf of a practitioner, before the practitioner has had their details added in PCA, there is a sort of consent statement to ensure that that practitioner has been provided a copy of the PCA privacy policy, for example, to ensure that they have in turn consented to having their details stored in the system and then distributed to various business partners.
Yeah, great. And thank you, Jenny, for stealing one of my questions that I had prepared earlier. I think that was a very good one. Next here from Colleen, what if a doctor is a VMO doctor and has 2 provider numbers?
Yeah, so provider roles in PCA, you'll be setting up a practitioner role or a provider role at every organization that a practitioner provides services at. So let's say they work at Sydney Medical Centre, you'd be adding their listing at Sydney Medical Centre with their provider number specific to that location there. And then if they were also to work at Brisbane Medical Centre, you'd set up that second role linking for them at that second medical centre with that different provider number there.
Yeah, great, thank you. One here from Kath, when we publish, are there rules about what business partners can do with the information? For example, we have closed books and so not available to the public.
I'm happy to take that
Okay.
one on, and
Thanks,
you can correct me if it's wrong. Essentially, it depends on who the business partner is. In the case of eHealth New South Wales, we don't publish or make that visible anywhere else outside. So nobody will see and know about it. A lot of the problems people have had in the past about the National Health Services Directory is that it is outside facing. In this case, if you know how it's going to be used by who you decide to tick as an organisation you want to publish it to, then it's quite simple to know, because there is, if you select New South Wales Health, for example, there's a little pop-up that can tell you what we will and won't do with your information, and so will all the others. And that way you can choose, yep, I want them, but I don't want these. How am I doing?
So very good, Abe. That's exactly right. So when a business partner does come on board with PCA, you are right. We are required to put in writing there a statement as to our use of that information. So that is available to all users before they publish. Now that's all the questions I've got on the chat there. Just as a follow-up to that one from Kath, actually, this is a question I personally received as a digital health officer of the PHN, and that is, how can users get access to PCA's privacy policy? I'm pretty sure it is on the homepage of the PCA portal at the very bottom. There's a link. I think I'm correct there, Michael Tang. That's certainly publicly available. When people first log in, if they just scroll to the bottom of the page, the privacy policy is there for people to read.
Yeah, that's exactly it, Brenton. And you don't have to log in to be able to read that. You can access that from the link in the footer. And when you open up that link, you can download it as a PDF as well.
Correct. Thank you. I don't see any immediate hands up for now. We do have
I have a
about
question I want to ask the people on the call. If they don't want to come up with one, I'll throw in it. The idea of having one place that will update your information and contacts across all of New South Wales in eHealth, so you never have to worry about it again unless you have changes of staff. Is that appealing? Is that seen as a good thing? Do you fed up with the frustration of not getting documents that you're waiting on? And we're hoping to get that problem out of the way as I described in my diagram. I'm just curious about GP practices and what their thoughts are around that.
Sure, thanks. I do have Kath Kennedy. Your hand is up. You're welcome to unmute.
I was just going to say that I think there is amazing value for a service like ours. It's just that I feel like we're going to have to donate a left kidney to get there in terms of the sign up, but then the consent from our providers. But I'm hoping the effort is going to be worth it.
Yeah.
Can I just add to that, Kath? I think that's a really good insight that you've provided. And I just wanted to clarify with the consent for providers, it's a tick box, and Tang, correct me if I'm wrong, or add to this if you need to, but when you're adding the provider details, it's a tick box to say that this provider has consented, rather than you needing to like get signed consent or something like that and provide that. It's not sort of that kind of consent. It's more an acknowledgement and basically you declaring through the sign up process that your providers have been made aware through your own process. So that hopefully should streamline the process a little more, and it's simply registering and going through and declaring and acknowledging all the privacy statements that you'll see as you sign up through the portal.
Yes, agree. I'm just laughing privately. Yes, you're right, Kath. Look, it is one of those things that where possible, we can try and remove a little bit of the pain along the way. Of course, the Australian Digital Health Agency, I'm sure, in the design and development of this have gone to great lengths to try and think about how they can streamline this. And I've seen firsthand from the PHN's perspective the development pipeline and the updates that have happened in the lead up to where we are today. And there's been some vast improvements, especially with the Wizard, for example. We didn't have the Wizard during the pilot. They took on their learnings from that pilot and have delivered something pretty quick to market, which I have to say is greatly appreciated. I do have another question here from Jenny. Once practices are using PCA, you'll need to be on their onboarding process list for new practitioners. That's a good observation. I don't know if that was a question or observation, Jenny, apologies. It sounds like a very good...
I think it's an ideal comment, because
yes,
you just get into the routine, and if you haven't gotten to, oh, we're taking on new staff, we better remember to do that in PCA. That's really what's needed.
Absolutely. Good, definitely a good idea. Okay, another question here from Sajida. We use best practice software and ITT for IT support service and hardware issues. How will they be involved?
So it's Tang again here. I can jump in for this one. So with a lot of software systems, clinical software, prescribing software, dispensing software that may already hold your information currently, we are working with a number of them to form an integration so that they can push your details to PCA, so that you don't have to enter in every little thing into the PCA portal. So we are currently finalizing our publishing system requirements so that these vendors can come on board and integrate with PCA. And we will be having those discussions with them to support their onboarding in due course as well. So that is on top of being able to log into the PCA portal and adding your details there. We'll be also aiming to synchronize your details with various systems to reduce the burden of having you update so many different places at one time.
Thank you, Tang. Another great question here from Kath, very appropriate given the location. So like many places, we are currently using a lot of locums. Would you add them to PCA?
Yeah, so in PCA, the process of Linker practitioner is very quick. So all you need to do is add their APRA number, or you can also search for their APRA number by their name, first name and last name. Once they're in and you check the box that Brianna just mentioned, that you've provided them a copy of their privacy policy, in PCA there is also a field for a start and end date. So if you know a locum's going to come in for, let's say, a 1 month stint or so, you'll be able to set that 1st of June to end of June, configure that in PCA, and that means you won't have to worry about them later when it's time for them to leave. That period of time will be programmed to PCA and then be sent on to business partners as well.
That's right. Yes, Kath, thank you for that question. A very similar question to that actually is one I often hear is how often would I have to log in to PCA once I'm set up and I've published? And I know that often the response is, well, when anything changes, when new providers come and go, if your location changes or your services change, that's when you would go in and make those changes and update. I've got a hand up. Jacqueline Allison, you're welcome to come off mute and ask your question.
Oh, thanks. I'm just curious to know, is there a limit per organisation to how many providers you can have in the PCA database?
Thanks for your question, Jacqueline, and currently no limits because PCA is designed to support all types of healthcare services, whether that's a general practice, a small one in the community, or a large public hospital.
Yeah, great question. I've got a question which is sort of similar to that, and this is, what if I have more than one organisation, so sub-organisations? I've got the one ABN, but I've got 2 or 3 practices, say. How would that work in PCA?
Yeah, so PCA, there's a structure to it. So you can have one parent organisation at the very top of the tree. And part of that one parent organisation with ABNs is you can set up sub-organisations below that before you get to listing the various locations that are a part of each sub-organisation. So again, more than happy to have that chat with you, especially if you are a bit confused about how your structure fits into PCA, and we can help support you determine that and add your details into the system.
Yeah, no, thanks, Tang. I think that's going to apply to a few. We've got, especially, I know that within our region of Western New South Wales anyway, we do have the one ABN being shared across multiple locations, multiple different practices, and they're different names. In some cases, we have, of course, directors or owners having an ABN for each. So I'm assuming if you've got an ABN for each, you would need to register more than the once for each ABN. Would that be correct?
Yeah, so the registration of PCA is per ABN, the organisation. But if there's, let's say, a larger organisation that shares ABNs, you can have multiple staff members manage different, I guess you could say, wings of that organisation or groups of locations.
Yeah, no, thank you. And of course, a reminder to all that when you're logging in to register under step 1, of course, when you do look up your ABN and you get the red cross, you can call your PHN because it does mean that your ABN has not been preloaded for this particular phase, this rollout phase, until June 30. So please get in touch with your PHN, your digital officer, and they can assist you or contact the agency and we'll need to preload that ABN so that you can get the green tick after you put your ABN and then proceed to access those agreements and proceed. So look, I'm conscious it is now 8 p.m. I don't see any more hands up or questions come through. So if it's okay, I'll call the Q&A, bring that to an end. I'm just going to quickly share my screen because I would like to formally thank all of the presenters, the panel members today for their time and energy on this. This has been a webinar, an information evening. I know I've been very excited about it, and a lot of questions have been raised, and I think the support has been fantastic. So look, on that note, of course, we do encourage feedback, and there's an evaluation we would like you to complete, please. This is a QR code on the screen now. Hopefully you can see that. All feedback is encouraged. This is a slightly different format to what I know I've done in the past. I'm treating it as a bit of a Q&A. I was expecting a lot more questions, to be honest with you, in the hope that we could follow up with answering some of those in a post email, but I'm very proud of the fact that we finished pretty much on time as scheduled. So on that note, thank you all for your time, and we'll hopefully see you again in the future. Thank you.
Thanks, Brenton, and thanks everybody.
Thank you.
Thanks so much. Have a good night.